step after you've moved the horse at the walk and the trot in a straight line is to do some flexion tests. For these, it's really important that your handler is always on the same side as you. And I generally start on the left side because the horses are generally used to being handled on the left side. And it's important though to flex both sides. Even though we're seeing that Tommy is the most lame in the left front, we are going to flex all of his limbs today. All right. So the first flexion that we're going to start with is the lower limb. And again, we're going to start with the left front. For this, it's really important that we don't overflex the limb up, because then we're going to be flexing the carpus. So in this flexion, you want to bring the fetlock down as far as you can. And a really good technique is to actually brace the horse's forearm into your shoulder so that you can torque the joint that way. And you can even bring the leg out as much as you can so that you're not flexing the carpus at all. So I hold this flexion for 30 seconds. And you can either time it with a watch. I'm not wearing a watch, so I generally just kind of time it in my head. While I'm doing this flexion, I'm going to be kind of feeling how he thinks about it. So he's actually struggling a little bit while I'm doing this. So that tells me that maybe he has a little bit of pain from the joints that I'm flexing with this flexion. If the horse starts to get away from you and you're fairly far along in your flexion, you can just let the horse go. So then I count down for my jogger so that she knows that it's time to go. So Bethany, I'll count down from 5 and then you're going to take off at a trot. Okay, on a trot. So we can see that actually made him more lame in the left front. So we would call that a positive flexion test. And then you can walk back. Sometimes I'll trot the horse up and down, but usually you have a feel by the time that they've gone that 20 yards as to whether you're going to call that a positive or a negative.